The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to Question Lab. We're happy to have you here tonight as we dissect questions on the topic of biochemistry. Leading our discussion once again tonight is Dr. Paras Vakari, and he's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm currently an assistant professor in dermatology and also an RX coach with USMLE-Rx. So helping you guys as we walk through sessions such as these. Happy to help lead tonight's session on biochemistry.
So without too much of a further delay here, let's go ahead and begin with our first question of the evening today on the topic of biochemistry. As you can see, the answer choices are covered up. That is by design. We do that because we don't want you to see an answer choice that you're unfamiliar with, and you know, maybe that makes you panic as you're trying to answer the question. But we also don't want you to see the answer choices and have your thought process dictated by those choices. So we cover those up. And after we cover up the choices, we'd like to begin with the lead-in, which is the question itself, or the last sentence. So let's take a look at that lead-in now. Which of the following enzymes is most likely deficient in this patient? Which of the following enzymes is most likely deficient in this patient? After we read the lead-in, we'd like to ask our students how many steps they believe this question will require. So an example of a one-step question could be where you're asked for the diagnosis. An example of a two-step question is when you're asked for the treatment for a diagnosis. And an example of a three-step question is when you're asked for the mechanism for a treatment for a diagnosis. And we do that so you can have an organized thought process and make sure they're answering the correct question and not making any careless mistakes on test days. So we'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And then we'll move on to that vignette. All right, I'll give all you a couple more seconds here to respond to that question box. All right, I see the responses coming in. Let's take a look at that vignette. An 11-year-old boy is brought to his pediatrician by his mother because of recent episodes of lightheadedness, racing pulse, dizziness, and nausea. On physical examination, there is generalized decreased muscle tone, and the liver and spleen are palpated a few centimeters below the left costal margin. Laboratory studies show increased creatinine kinase and decreased glucose levels. Urine ketones are positive with negative glucose. An electromyogram shows features of myopathy. Which of the following enzymes is most likely deficient in this patient? So I want you to all start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in, okay? And so starting off, you know, the first thing that we're given here are demographics. We're told this is an 11-year-old boy, okay? So you want to make note of that, a little bit of a pediatric case in this scenario, okay? And then they tell us that he's coming in because of recent episodes of lightheadedness, racing pulse, dizziness, and nausea. Those are what we call the presenting signs and symptoms. You want to make note of that because that's what brought them in to be seen, okay? Now in this case, you know, we are working with the biochemistry question, so, you know, you definitely want to make note of some of the things that we've highlighted there, you know, things about muscle tone, liver, spleen, levels of certain things in the blood and urine. And so you definitely want to make note of those things as we have kind of pointed out there as well. So they're then asking us about the most likely deficient enzyme. So I think we have a two-step question here. I think one, we've got to come up with the diagnosis, and then two, in that diagnosis, figure out what is the deficient enzyme, or know that. So I think we've got a two-step question here. So what we're going to do is we're going to go ahead and show you those answer choices. We've got 5 answer choices in this question. And when we work with students, we actually recommend that students, as they go through these choices, that they actually start at the bottom, or answer choice E, and work their way up to the top, answer choice A. And the reason we do this is because a lot of times we'll see students who start at the top, they'll select something they like without going through all the answer choices. So sometimes, as a result, they'll get that question wrong. So we recommend doing it this way to prevent yourself from making that mistake. So we'll go ahead and do that now. E, myophosphorylase. D, lysosomal acid maltase. C, glucose 6-phosphatase, B, debranching enzyme, and A, branching enzyme. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. The poll is open. Once again, we're going to wait until about 2/3 of you have responded. Keep in mind that there is no penalty for guessing on test day, so make sure you never leave a question blank, and especially not tonight. If you're not sure what the answer is, don't worry, take your best guess, and then we will review the correct and incorrect answer choices here together in a moment. All righty, let's take a look and see what you selected. It was close. 34% of you selected debranching enzyme and 30% of you selected myophosphorylase. Let's take a look and see what the correct answer is. And the correct answer is indeed B. It was our top choice, but definitely a challenging question. Let me hand it off to Boris.
Thank you, Sean. Yes, definitely a tough question. So let's take a look at this question, see what's going on here, okay? Now, this patient has issues with muscle tone, also has an enlarged liver or spleen or hepatosplenomegaly. They also have low muscle tone, like we talked about. So this patient likely has Cory's disease, okay, which is a glycogen storage disorder type 3. So if we take a look at the next slide, we can actually see that some of those signs and symptoms that our patient had, okay? And this is actually, sorry, I think one of the wrong photo or table might have been put here. So don't worry, we'll kind of just go over that. So what this patient had was Cory's disease. Now, Cory's disease results from mutations in the gene that encodes the debranching enzyme, okay? And what happens is in this issue, you have an inability to break glucose from glycogen, okay? So these glycogen-like molecules accumulate in the cells of the liver, the spleen, especially the liver, and so that's how you get hepatomegaly, okay? Now, because you're not able to break down glycogen, patients also get hypoglycemic, okay? Kind of like our patient here, okay? And on top of that, patients can get elevated creatinine kinase like our patient because glucose is now coming from muscle breakdown instead of the liver, okay? In case you selected one of the other answer choices, answer choice E is getting at McArdle's disease, which is glycogen storage disease type 5. And that usually presents with M issues like McArdle, myophosphorylase. So M for muscle cramps, myoglobin in the urine with exercise, not what we're seeing here. Answer choice D is getting at Pompe's disease or glycogen storage disease type 2, which usually leads to cardiomyopathy type picture, which we're not being told about. Answer choice C, that's getting at von Gierke's disease. That usually presents more in infancy. Remember, we had highlighted that this was an 11-year-old boy. Von Gierke's disease presents in infancy with severe fasting hypoglycemia, elevated uric acid levels, lactate levels. So not what we have here. And then lastly, answer choice A, that is getting at Anderson's disease, which usually also presents in infancy with hepatosplenomegaly and failure to thrive. Our patient's a little bit older. So answer choice B with the diagnosis of Cory's disease is the best answer here. So great job on this first question.
Excellent. Thank you very much, Paul. Let's move on now to our second question of the evening. Once again, the answer choices are covered up. That is by design, and we will begin with that lead-in. Which of the following mechanisms best characterizes this patient's most likely diagnosis? Which of the following mechanisms best characterizes this patient's most likely diagnosis? Once again, we'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And then we'll move on to that vignette. All righty, looks like we got some responses coming in already. Let's take a look at that vignette. A 4-year-old boy is brought to the emergency department for knee pain and swelling after a minor fall while running one day ago. He has a history of easy bruising and recurrent skin and respiratory infections. Temperature is 38.3 or 101 Fahrenheit. On physical examination, his right knee is warm and tender on palpation. He has very fair skin, white hair, and light-colored irises. Which of the following mechanisms best characterizes this patient's most likely diagnosis? Faris.
Thank you, Sean. So what we're going to do is now we're going to walk through this question and show you what we think are the important clues here in this vignette in the lead-in. Okay. And now you can see that we've got a 4-year-old boy, so a little bit of a younger patient here, but still a pediatric case. Okay. And his presenting signs and symptoms are knee pain and swelling after a fall when he was running a day ago. Okay. Now they tell us he has a history of easy bruising and recurrent skin and respiratory infections. Okay. We see that he's febrile. We also see some abnormal physical exam findings there. Okay. They tell us about dermatologic history, about fair skin, white hair, light colored irises. Okay. So you definitely want to make note of that and figure out how that's playing in here. So then they're asking us about what mechanism best characterizes the most likely diagnosis. So I think we've got a couple steps here. I think one, we've got to figure out what is the most likely diagnosis, and then two, what is the mechanism or pathophysiology of that diagnosis. So I think we've got another two-step question here. So once again, let's go ahead and let's take a look at those answer choices, and we're going to start at the bottom and work our way up to the top. Answer choice E, tyrosinase deficiency. D, phenylalanine hydroxylase deficiency. C, mutation of the X chromosome. B, microtubule dysfunction. And A, autoimmune destruction of melanocytes. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you, Faris. Once again, the poll is open. Keep in mind that we do have a raffle at the end of tonight. You must be present to win, so make sure you stick around. And as always, we do have a special offer also for all of you in attendance. I see the responses coming in. We'll give all of you a few more moments here to lock in your answer. All righty. Let's take a look and see what you selected. 40% of you selected tyrosinase deficiency, and in second place we had a tie between D and B, phenylalanine hydroxylase deficiency and microtubule dysfunction. So let's take a look and see what the correct answer is, and the correct answer is B, tied for second place here. Let me hand it off to Paula.
Thank you, Sean. Yes, definitely a tough question. So, these are definitely tough questions, especially when you have these, we call them pigmentary dilution type presentations. So patients who have pigment dilution in certain areas, what we call fair skin, white hair, light colored irises. But we also are being told that this patient has some issues with bruising and recurrent infections. Okay, so it's not just a pure skin issue here. Okay. So this patient likely has Chediak-Higashi syndrome, okay? If we take a look at the next slide, we can take a look at our first aid table on Chediak-Higashi syndrome, okay? You can see there that it's a defect in lysosomal trafficking that leads to microtubule dysfunction. What happens as a result is patients get neurodegeneration, partial albinism, recurrent infections. They also can have coagulation defects because of issues with platelets. Okay, so kind of what our patient has: infections, albinism, and issues with coagulation and platelets. So if we go back to our vignette, hopefully now you can see how this patient kind of fits that category. Okay, recurrent infections, easy bruising, pigmentary dilution or partial albinism, And this, with Chediak-Higashi, it's a defect in microtubule dysfunction. So answer choice B. Now the other answer choices, in case you selected that, tyrosinase deficiency. Now that can lead to albinism, but it wouldn't likely lead to other things such as recurrent infections, okay? So that doesn't explain all of the signs and symptoms that this patient has, which is why it's important to highlight them and make note of them, okay? Phenylalanine hydroxylase deficiency, so answer choice D. That could be associated with decreased skin pigmentation, but you'd also hopefully like to see a couple other things such as seizures, musty body odor, and the patient's not really experiencing that. And on top of that, wouldn't really lead to recurrent infections or easy bruising. So not the best answer there. Answer choice C, that could be getting at Fragile X syndrome, which would present with microcephaly, long faces, macroorchidism, which our patient doesn't have. Also wouldn't lead to recurrent infections. Lastly, answer choice A, that's getting specifically more so at vitiligo, where you have areas of loss of skin, loss of color completely, but again, wouldn't lead to recurrent infections or bruising issues. So not the best answer choice there. So B is the best answer choice here.
Well, thank you very much, Bars. Definitely a challenging question. Let's move on now to our third question of the evening. As always, we will begin with that lead-in. A deficiency in which of the following characterizes the most likely diagnosis in this patient? A deficiency in which of the following characterizes the most likely diagnosis in this patient? Once again, we'll give all of you a few moments here to respond in the question box and let us know what you believe are the amount of steps required to answer this question. Alrighty, let's take a look at that vignette. A 43-year-old man comes to the clinic because of a painful rash on his forearms and neck, muscle weakness, and loose stools. He has a history of alcohol use disorder. On physical examination, the patient is agitated and disoriented. His tongue is enlarged and erythematous, and the affected skin appears thickened and hyperpigmented. A deficiency in which of the following characterizes the most likely diagnosis in this patient? Paris.
Thank you, Sean. So now you can see that we've got a little bit of an older patient here. We've got a 43-year-old male, okay? So we want to make note of that. And his presenting signs and symptoms are actually kind of involving a few different systems. He's got muscle weakness, loose stools, but also this rash on his forearms and neck, okay? They tell us about some past medical history, okay? So always want to make note of that. And then specifically, they're telling us about some abnormal physical exam and skin findings. So you want to make note of that, try to piece that together into figuring out what's going on here. So they're asking us about a deficiency that characterizes the most likely diagnosis. So I think we've got a few steps here. I think one, we've got to figure out what is the most likely diagnosis, and then two, what is deficient in that diagnosis. So I think we've got a two-step question here. So once again, we're going to go ahead and take a look at those answer choices, and we're going to start at the bottom and work our way up to the top. E, zinc. D, tryptophan. C, thiamine. B, pantothenic acid. And A, biotin. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we will talk about it in just a few seconds.
Well, thank you very much, Boris. Once again, the poll is open. Our third question of the evening. For those of you wondering, next week's topic is going to be public health. I see responses coming in. I'll give all of you a few more moments here. Alrighty, well, let's take a look and see what you selected. Clear favorite here was thiamine with 45% of you selecting answer choice C. In second place, we had tryptophan with 35% of you choosing answer choice D. Let's take a look and see what the correct answer is. And the correct answer is D, tryptophan, and 35% of you got it right. Let me hand it back off to Paris.
Thank you, Sean. Yes, great job with this question. This is definitely one of those tougher biochemistry questions where they're asking about specific minerals and vitamins and amino acids. So let's take a look at what's going on here. So as you can see there from the picture, that's the kind of rash that that they're getting at, a rash that's affecting the neck and forearms. Okay, so when you think of that, why are they getting at just the forearms and neck? Well, that's mostly what we call a photodistributed area. Okay, so if you're wearing a t-shirt, you can still get sun exposure on your neck and your forearms, but your chest and your back would be kind of spared. Okay, so that's kind of a photodistributed area. Okay, now this patient has dermatitis. This patient also has diarrhea as well with loose skins, and then also has dementia type issues with agitation and disorientation. So they're getting at the 3 Ds of pellagra, which is due to niacin deficiency. So if we take a look at the next slide, you could see here, this is our first aid table on vitamin B3 or niacin. And you can see there how this can present. This can present with glossitis, which is an enlarged tongue. Our patient did have an enlarged tongue, okay? And also, severe deficiency leads to pellagra, okay? And you can see how that presents with diarrhea, dementia, dermatitis, and, which includes hyperpigmentation of sun-exposed areas, okay? Now, niacin is derived from tryptophan. So if you were to have a decrease in tryptophan absorption or an increase in tryptophan metabolism, what they have listed there, for example, that could result in pellagra, okay? Which is why answer choice D, or tryptophan, was the best answer here. So if we go back to our questions or our answer choices, you can see tryptophan is the best answer here because niacin is derived from tryptophan. So if you have a deficiency in tryptophan, that would present with pellagra-like findings. The other answer choices, in case you selected that, so zinc can also present with the rash, but that's more of a peri-orificial rash, so a rash surrounding the mouth, the orifices, also results in issues with delayed wound healing and hair and taste and smell issues, not what we have here. Thiamine can lead to issues with a variety of organ systems, including issues with your eyes, ataxia, Wernicke-Korsakoff type syndrome as well, which we don't really have here. Pantothenic acid can also cause issues with dermatitis, but you wouldn't really have some of the other things that we do have, like the photoexposed rash. Lastly, answer choice A, biotin, that can also cause issues with dermatitis or rash, but a deficiency would also cause issues with alopecia. You probably also wouldn't really have mental status changes like we do here. And again, the history of alcohol use also points as well towards a different diagnosis. So the best answer choice here is D, like you guys selected.
Excellent. Well, thank you very much, Boris. Let's move on now to our last question of the evening on the topic of biochemistry, and then we'll move on, of course, to our raffle and special offer. As always, we're going to begin with that lead-in. Which of the following is a substrate for the enzyme that is most likely deficient in this patient? Which of the following is a substrate for the enzyme most likely deficient in this patient? We'll give all of you a few seconds here to respond in the question box and let us know how many steps you believe this question will require. And then, as always, we'll move on to that vignette. All righty, let's take a look at that vignette. A 3-year-old boy with a history of recurrent bacterial and fungal infections is seen by his pediatrician for a new skin abscess in the left axilla. Many of his previous skin abscesses have been positive for Staphylococcus aureus. On physical examination, there is generalized lymphadenopathy, hepatomegaly, and flaky plaques on his arms and legs. A diagnosis is confirmed with a test in which nitro-blue tetrazolium dye is used. Which of the following is a substrate for the enzyme that is most likely deficient in this patient?
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and this lead-in. So this is kind of our fourth time doing this. So, hopefully you guys are starting to get a sense of what are those important clues in these biochemistry questions that can really help get you to the correct answer, okay? So if we take a look here, we've got another pediatric case, and that's pretty common with biochemistry, with a lot of these inherited disorders of metabolism, okay? Now, he's coming in because of a new skin abscess in his left axilla, but we know that he has a history of recurrent infections of both bacterial and fungal type, okay? So they're then telling us that, he's had Staph aureus infections. They're telling us about these physical exam findings, this rash on his body, and then also the specific test that they're telling us about. And we want to make sure that we know what they're getting at with that diagnosis. So they're then asking us about an enzyme that's most likely deficient, but not just that, they're asking us about a substrate for the enzyme most likely deficient. So I think we've got a couple steps here. I think one, we've got to figure out what's going on in this patient, what's the condition, the diagnosis, and then two, what is the enzyme deficient in that diagnosis? And then three, what is the substrate for that enzyme? So I think we've actually got a three-step question here. So once again, we're going to go ahead and take a look at those answer choices. We're going to start at the bottom and work our way up to the top. E, superoxide. D, oxygen. C, lactic acid. B, hydrogen peroxide. And A, carbon dioxide. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Parv. This is our last question of the evening, so let's try to finish strong. Let's see responses coming in. I'll give you a few more moments here. Looks like there's a clear favorite so far, but it's close. All right, let's take a look and see what you selected. It was very close, actually. We almost had a three-way tie. But inching ahead with 31% was hydrogen peroxide, and tied for second place with 30% was oxygen and superoxide. So let's take a look and see what the correct answer is. Oxygen, which was tied for second place. Let me hand it off to Parv.
Thank you, Sean. Definitely a tough question here, so great job with this. Let's take a look at what's going on here, okay? So one, what is the most likely diagnosis this patient has? Well, this patient most likely has chronic granulomatous disease, or CGD. And that's because of the lymphadenopathy, the recurrent infections with staph, bacterial fungal infections, and also the rash, the flaky plaque, so eczema type rash on the arms and legs, okay? CGD is caused by a deficiency in NADPH oxidase activity, okay? And this NADPH oxidase is used by neutrophils to destroy pathogens using a mechanism that we refer to as respiratory burst, okay? So if we take a look at the next slide, what we see here is that respiratory burst, okay? This plays an important role in the immune response. And you can see there, of those enzymes and steps in the respiratory burst, the very first step is done by NADPH oxidase. And a deficiency in that leads to what our patient has, chronic granulomatous disease. And you can see there from that image, the substrate for enzyme number 1 is oxygen, okay? So oxygen is a substrate for NADPH oxidase. It's converted into superoxide anion that then gets converted eventually into hydrogen peroxide that, you know, and then other reactive species that destroy the pathogen. But the very first substrate for this enzyme is oxygen. So if we go back to our question, and we take a look at the answer choices, hopefully you can see why D is the best answer. Oxygen. That's the substrate for the enzyme NADPH oxidase, which is deficient in chronic granulomatous disease. So hopefully you can see each of those 3 steps. Now the other answer choices, in case you selected that, superoxide, that's a substrate for superoxide dismutase, which is a little bit downstream of that. Lactic acid, a little bit more has to do with anaerobic metabolism. It's metabolized to pyruvate by lactate dehydrogenase. Hydrogen peroxide, that's a substrate for myeloperoxidase. Again, a little bit more downstream of what we were referring to. Carbon dioxide, that's a substrate for carbonic anhydrase, which is a little bit different as well. So the best answer choice here is D. So great job on these biochem questions today. I know these are some tough questions that definitely get into the nitty-gritty of our basic sciences, but you guys did great. Keep up the good work. I will pass it back to you, Sean.
Well, thank you very much, Pars. Great job tonight, as always. Here are the questions that we did today. The question IDs, you can simply type these into the RX search field and review them further if you'd like. I'll leave these up for a few seconds so you can take a screenshot or make note of these QIDs.